Welcome to when nurses are the 911 to 911, and it's you that needs saving. Building mental readiness into your daily practice. Hi, I'm Natasha Lukasiewich, and I have had many nicknames through my 2 decades as a nurse, such as Pocket Nurse, the Nurse Doctor, known as a Little Ninja, Spitfire, and with my 5'1" stature, my personality actually comes in larger than life at times. So as we adventure today in today's Nurse Converse podcast, please know that my opinions are my own and they do not represent any of the organizations I work for or associated with. Please be aware that there will be some sensitive content covered today. And so if it is a little bit bothersome or triggering, please check in with a buddy or a peer and talk about it. So going back to my background, I really do have my mom to thank for starting the road to mental readiness and resilience. She started off making sure that when I was smaller and younger, that nobody was going to steal my lunch money. And she did this by helping me tap into my agility through gymnastics to my early start into martial arts, and that carried on through my life. I was born and raised where I saw the Northern Lights growing up, which was absolutely fantastic, in a place called Edmonton, Alberta, Canada. Believe it or not, I was actually becoming a marine biologist. And then one day I was studying in the library. And of course, many of you who work in ER or hospital environments, we have squirrel brains. And it took me on a journey, and I actually discovered all of the other type of programs out there. And this is when I was at Grant MacEwan University in Edmonton. So many of you probably thought I might have discovered nursing then, but actually that is a big nope. I decided that I wanted to be a holistic health practitioner prior to becoming a nurse. And it was an amazing experience and probably one of my biggest personal growth journeys I ever had, and have been able to carry that throughout my nursing journey and my personal and professional life. So integrative medicine definitely changed my mindset. And why does this matter? Because statistically thinking, and there's a lot of you out there who have similar threads as me, is that really the adversities that I have gone through in my personal life with my family, statistically, I shouldn't be here. And you'll understand a little bit more. And I really do think has a lot to do with having the great small circles of support and strange kinds of love, if you will, for those that stood by and believed and saw my potential. So I am a little bit of a success story, kind of an underdog. And those of you who may be tuning into this podcast, I have you all to thank. You all know who you are. And let's start off with just sharing a little disclosure. My father died of suicide when I was 7 years old, and my amazing mother worked multiple jobs. She tried hard to provide to raise my sister and I. She never had the greatest luck with marriages or relationships, but we knew in our hearts we wanted to have a better life, and she really did try her hardest to do that for us girls. This is where my lived resilience has come in and journey. And for those that are familiar with what's called ACE scores, those are known as adverse childhood events, mine are very high. But where I lucked out and what I talked about is having the great love and the few people and teachers that saw my potential and made sure that I made it through life. But this podcast today is not about me. It's about creating mental readiness and resilience in our workplaces. And I wanted to be able to share that with you because it really has been a lifelong journey through my personal professional research, experiences, and just things that I've observed. But because of this, and wanting more education is where I realized back when I was doing my holistic health practitioner degree that I realized I actually had prerequisites for nursing. And so taking us back to that early part of my career is where I actually wanted to go in and do oncology nursing, but the universe had a little different curveball for me, if you will. So as much as we try to plan our lives, just know if you have the adaptable mindset and infinite mindset, and you say yes and go with it, you will go on some amazing journeys, and I'll share some more of that in this podcast. So because of the weird circumstances, I ended up actually doing my final practicum in the emergency department outside in a place called Stony Plain. This idea literally scared the bejesus out of me, but I lucked out again because there were some amazing nurses in that emergency department who realized the potential I had and took me under their ER nursing wings. And that's when I was hooked. I could not believe the amazing guardian work all these fine people did. And I was hooked by the variety and the adversities of how I got to help so many different people. And then I realized, you know what? I can go anywhere in the world. So let's go and take it back a little bit. So I want you to imagine getting up one day and deciding you want to try base jumping or skydiving. I have personally done skydiving. And you realize the first time you do this, you're never going to do it alone. So you could be tied to the back of somebody's back and know that, okay, this person's done it before. I can do something really scary and you might not know what's coming, but as long as you have your team or your peer or that person to your back, you know you're going to get through it. So some people would say, heck no, and only insane people would choose this. But what about those who run into burning buildings? What about that? Who has that right mindset? Or those who run towards stray bullets coming that way. There is a certain population in this world that we have a lot to be thankful for, and those are the servant industries. Emergency medicine is a lot like this daily. You have a team, and every day you show up, you jump in together with trust into some of the most precarious situations, and you really got to get comfortable with being uncomfortable. So when life fails, where do patients go? The emergency room, right? We all can agree with that. Emergency medicine has changed over the last 2 decades that I have been nursing. We no longer just specialize in emergent situations. The emergency department has become the rescuer to all because there's a lack of access to care, and that literally has escalated through the stratosphere, if you will. Outside entities know that emergency departments, that they can never say no, they can never shut the doors to patients, regardless how many show up at once. So when other disciplines are in doubt or they're short-staffed and they can't figure out who's going to navigate that person's socioeconomic challenges, or they can't, say, get pre-approval for insurance companies for procedures that they want, they send them to the emergency department because they know there's loopholes. Now, go back to decades ago when mental health programs were cut off of funding because that was not a priority. Today, we are seeing that probably 20-fold, if you will, the biggest pandemic that we're having in mental health crisis. And it's not just affecting the public, it's also affecting those who have been serving. Look at our cousins who are in law enforcement, EMS, fire service. They feel the crunch too. And ultimately it comes down to all of those people funnel into the emergency department because we are the 911. Healthcare systems haven't even been able to tackle the inpatient side of the hospital, which is a whole different culture on its own. They too depend on the emergency department and teams when there's an emergency or a code blue, or if they're short-staffed or their beds are full, or surgeries are just pumping out, procedural services. The end result, the emergency department gets to hold and board those patients as well until we figure out staffing or bedding the next day. So again, as a reminder, emergency departments can never close their doors. And this is due to federal laws that prohibit this, and no other healthcare entity is held to these federal standards, and maybe they should be. Maybe it's a time that we look at that. And there's laws that are called EMTALA, which stands for the Emergency Medical Treatment and Labor Act. This was enacted in 1986 to make sure that anyone that did show up on our emergency department doors, that they would not be denied of care, regardless of ability to pay. And this is a good thing. We need to see this. We want to see people have access, but also it's been one of those things that have caused some of the bottlenecking that's happening today. And so we're seeing this impending doom, if you will, across the nation in emergency departments where other public health entities know that they can use this to their advantage because they can close their doors or shut down where we don't have that luxury. So for any of those that may not have worked in the emergency department, we are a special breed, just like any other department. ICU is a special breed, tele, we all have our specialty, but many will never understand why we do it. Mostly I'm convinced because we all have undiagnosed ADHD, or maybe it's a way that we can all heal our own past trauma by being the light in those who have their darkest days. We have this dark humor. We can eat lunch right after the most grotesque things that present. Regardless of the reputations that people think of ER teams, we have hearts of gold, intelligence like an elephant, emotional vests made of iron, and only a select few get to experience the tender moments that they choose to share. And I call those little miracle moments. I love being witness to those every day. We have to be this way, or we would never be able to show up the next day to do it over and over and over again. So back to my solo journey to America. This was in 2005, 2006. I made the journey down to Central Coast, California with my little Dodge Neon. Everything that I owned was in that car. I had no cell phone reception. I had fold-out maps. I weathered blizzards. And then I ended up in the busiest ER at that time in the area with no trauma hospitals around. And then I was hooked. I loved this area. I later ventured into rotor flight nursing, if you will, later search and rescue with a local sheriff department in Nevada. And then I ventured into becoming a trained peer support and critical response professional with the local sheriff department. There, I helped pioneer the first ever advanced practice healthcare professionals being embedded in search and rescue, austere environments, and being able to show that advanced interim care actually can help improve patient outcomes in very rural areas. And I'm very proud to say this team is going strong and has even raised the bar further. In that time, I had side gigs such as a legal nurse consultant, edutainer, staff development specialist, and also helped pioneer a trauma program from the ground up in the Lake Tahoe Basin. I also started my leadership quest to becoming an emergency nurse manager, which brings me to my current role today as a director of emergency services in Central Coast, California. So what a wild ride this has been. I share these things just to show those who might be embarking newly on their nursing career what you can do with it. And it really is, if you have that infinite mindset, yes, I can do that, face your fears, your career is going to be the most rewarding. And if I would have tried to plan this, it would have never happened. So part of my passion is bringing what I call the continental divide that occurs in frontline staff and administration. I never understood the big gap where we're all supposed to be on the same team, the same fight for patients and same outcomes, but we all know there's subcultures that exist and competing needs and struggles to balance out. So I can hear those of me who are tapping me on my shoulder saying, you've left some details out, Natasha. And yes, just to give you a little background and maybe some academia cred, I am dual master's trained and I have a doctorate in nursing practice. And so that is where I've done a lot of focus in my studies, is raising the bar and my personal bar and being able to build resilient teams. So rewind to the last 2 decades while enjoying the privilege to do all this amazing work. I do remember childhood teachers getting mad at me for staring out windows in the classroom, and maybe some of you can relate, and lecture me about how if I don't pay attention, I'll lose out, I'm not going to make it in life, and reminded me that no one's going to pay you to look out a window. Well, I would just like to share to those teachers that they were wrong. I have laughed many times in my flight nursing days and hearing that rhetoric in my head over and over and being like, oh yeah, I'm looking out the window right now, I'm getting paid for it. So just a little funniness and going back to inspiring those. If you ever get words of discouragement, keep going and believe in what your passion is. And so I wanted to say that part of my other resilience training came a lot from becoming a helicopter EMS crew member. You really had to practice being mentally ready to take care of the sickest of the sick. And dang, do I have stories about that? That would be a great podcast for another day. So from all my careers, I was starting to notice some dark sides to what we call, such as the multiple lives lost to suicide, post-traumatic stress disorder, substance use, and severe depression. So why are organizations not talking about these deaths and the loss of our work families? How can they keep moving forward and just sweep this grief under the carpet? Or at least that's how many of us feel. And we're left behind to pick up the pieces and have an understanding and cope. And people don't realize those who are left behind have a secondary victim syndrome and are very challenged with processing that. So after all, since I was taught at a young age to process grief, thanks to my dad's suicide, I've had the lived experience with this. And I want to be able to share with all of those out there that these issues, if you take them head on, it is attainable to move through it. And it's not a career ender. It's not a life ender. If anything, it creates something what you can have what's called post-traumatic growth and allows you to keep adding to your resilience mindset. In my 2 decades as a nurse, I personally responded to code blues. And then after events happen like this, I appreciate the great intentions organizations do by giving you accommodation awards. That is a very weird feeling to receive that, just FYI, and it leaves you very confused because you're saying, but wait, I didn't save her life or I didn't save their life. And why am I being recognized for something that the outcome I wanted didn't happen? So the journey continues in witnessing the loss of other first responders to suicide. And I know my stories are not unique, but I'm very candid and open because I want others to know that they're not alone. And there's others who have experienced this. And if we come together, we'll be much more united and stronger. So can we do better? And you know what? The answer is yes. So therefore, in today's podcast, I wanted to share with you a couple of tools you can implement today in your work environment. It's not going to be all the end all fix to, what's going on in your organization, but I like to give things, little tools as I do my talks for my listeners to be able to take home and into their organization and implement it. Probably what I'm going to say right now, I'm not going to make a lot of friends, but I know many organizations depend on their employee assistance programs. And really, there is better practices out there to help the staff. And I feel like this is one of those type of programs that really should go out to pasture. There's a lot of money that's dropped into these programs, and there's a great shift that's happening with some organizations that I've been witness to, part of helping. And that's where they're bringing vetted in-house trauma clinicians for their staff and chaplains and social work team members, and also building strong peer support teams. I have also been witness to the nightmare clinicians that they don't know anything about the industry or what you do, and they can actually cause more harm than good when they are calling the EAP and getting a caseworker, and they really don't understand the trauma or the language or the culture. And so this is something we really need to be cautious of. So, and how I know this, I have actually tested all the EAPs in the organizations that I've worked at, and I test them on a Friday night because we all know everybody who is maybe in, a 9-to-5 job goes home early. And it's very consistent in the themes that I find is like you call, if you're not in a true crisis where you need a suicidal intervention, but you're still really traumatized about what you experienced. Say if you had a bad pediatric code or something and you wanted to talk about it, they assign you a caseworker and maybe somebody will get back to you Monday. And then from there, you might be able to find somebody that can help you. And most programs give you 3 to 6 sessions of a service, and maybe that's enough for some people, but for really big traumas that need processing, that isn't enough. And then that person is left behind from starting from scratch and having to relive their trauma with a new provider and explain that and build that rapport. As you can see with my background, I'm a big proponent of supporting and building strong peer support teams. And this really is a great way to go up river, if you will, and to understand why people are jumping in the river versus, say, if you're doing, critical incident stress debriefing formats, where that is kind of where you're looking downriver and catching people when they fall in, and sometimes they drowned, if you will, and you're not able to get them out of there. So the next step is building strong, functional, and cohesive peer support teams, okay? And how you do that is there's actually a lot of resources out there, and I'll give you a link and an idea at the end of where you can find that. And I'm absolutely happy to connect on LinkedIn, if you will, and reach out and be able to share. There's a lot of free resources. You don't need to reinvent the, manual or how to do this. So just know that it's great to have peer support teams because they allow the next person to know that it's okay to not be okay. So I know this really simplifies things, but at the rate of depression and burnout and PTSD and suicide attempts, they actually have gone through the roof, if you will. Sad facts to give you an idea. We and those who serve in the servant industry are 3 to 10 times more at risk as experiencing mental health or suicidal ideation than the general public. This is very concerning. And the one way that I explain mental health injury, or what's called post-traumatic stress injury, to those, it's like having a concussion. I think all of you on here or anybody knows that if you get repeated concussions or blow to the head, eventually you're going to have a traumatic brain injury. Well, newsflash, actually experiencing trauma and burnout and compassion fatigue and untreated mental health issues goes exactly the same way. The repeated witnessing of the work traumas and workplace violence and not productive work cultures will actually cause you to have a traumatic brain injury, and your mind will literally shut down and tap out. There's studies that are showing that changes in our hippocampus volume, which is in the brain. MRI scans shows those that have PTSD that the brain is not like a normal person's brain. So there is an actual physiological change happening in our minds for the stuff that we're witnessing every day. So I have a great quote that I like to share, and it's research that was done by Glassburn. I think that was back in 2016. And one quote that has really helped keep my bearing straight in my navigation and focus is that our patients are only receiving the care as good as their providers. Now let me repeat that. Our patients are only receiving the care as good as their providers. So if our team members are taking care of the sick and the vulnerable and are not in their headspace and they're distracted, is this not a correlation to care outcomes? Let's think about it. Are our medication errors or lapse in judgment that leads to sentinel events happening to patient related due to this phenomena because we are not in a mental readiness state? Patients can actually sense whoever enters their room if they're in a good headspace, and it shows. I review our Press Ganey comments every week. And to give you an idea, when I did my DMP research at a level 2 trauma center, something interesting that I found there is that those healthcare professionals that had been there the longest actually had the highest resilience scores. So little tidbit and pearl, if you're putting new grads into your department, pair them up with your SAGE professionals because they might learn something from each other. And if you're listening and you have no idea what your own resilience is, there's a really good tool. I'll send a link in this podcast that you can get into, and it's called the Professional Quality of Life and Health Scores. And what this does, it allows you to evaluate in the last 30 days your own self-awareness to your compassion satisfaction scores, if you have perceived support, your burnout scores, secondary traumatic stress scores, and your moral distress. And it's eye-opening. And what's great about it is that there's a lot of great links and resources that can help you navigate through that if you have higher scores. So many times in this journey as being a mental health advocate for those that serve, many just don't know where to start or what to say, and that's okay. Just know if you're in true crisis, we now have the 988 number that we can dial. But for those conversations that are crucial or uncomfortable, it really comes down to the ministry of presence and having that peer supporter that knows how to guide them to the next steps. So active listening, being empathetic, something that I share a lot with the teams that I lead is something that's called the Umbuntu philosophy. This actually originated in Southern African indigenous people, and it embodies a communal ethos that emphasizes a shared responsibility, trust in each other, and interconnectedness among the community. This has to do with that we're stronger together because we are. So we're creating strong, resilient cultures in our unit and organization. And this is a key to success, to be able to have your teams show up every day and be able to still enjoy doing what they're doing. And looking at and really evaluating your staff engagement and satisfaction scores will also tell you about areas of growth. And then I think we all know that action speaks louder than words, and focusing on building the resilient teams is priceless. And part of that could be building peer support teams. So going back to the continental divide I spoke about between the frontline team members and management, many times there's a lack of trust, which is a key priority one should work on. But you can still communicate with doing what's called an emotional scene size up. And it's a mental readiness tool. And again, I'll do a good little attachment for that. And it's not a tool I invented. It actually started off with, I believe the Canadian Air Force uses it, the Red Cross uses it. And it's a color spectrum, if you will, from green, yellow, orange, and red. And under those columns is a way to evaluate your mental readiness for the day, if you will. So, I think most of us, when we're having a good day, we can relate that we're in the green. You're healthy, you're calm, you're in control mentally, you're sleeping well, you're not having difficulties. A lot of us live in the yellow doing what we do. And if you care for people, you kind of have to have a little of that hypervigilance, if you will. But when you start having, say bad cases and you're trying to process it, take a pause, go for a walk outside, give that time to decompress, call in the experts. But if you use this tool with your team and someone comes in and says, boss, I'm in the orange, I'm in the red, that means they have an injured mental state, if you will, or they're ill and they're having a hard time processing that. We really need to triage that like we would somebody coming in for, say, a chest pain, code stroke, code STEMI, all of those acuities, we need to start treating that we have to pay attention and see we've got some yellow flags going on. Other great teachings and takeaways that I share with my team is what's called an end of shift checklist. And no, it's not another checklist. It's just something you can put in your restroom or on your door. And it talks about before you leave, just take a moment and think about today. All right. Acknowledge one thing that was difficult about your shift and now let that go. And then another thing is taking 3 things that went well today in your shift and what didn't go well. And now we got to honor that. And then also checking in, are you okay and are your peers okay? This I call buddy checks. This type of reframe and mental readiness helps foster all of that. But believe it or not, Navy SEALs actually use very similar exercises to build their own mental readiness. Compartmentalization can be of use, especially when you're trying to eat an elephant. Not that I'm commending supporting eating elephants in this podcast, but we would do that one bite at a time. So sometimes life can seem very overwhelming, if you will, and that's how you want to do it. You want to take it one bite at a time. All right, so going back now, if you had embedded peer support team members, these individuals have special training and they have the ability to tap in and build rapport with their peers on the floor. And they are trained to be able to look for those yellow flags that I talk about, and they will help your team members navigate, hey, if we need to pick up a call because we have that vetted clinician in-house, do we call 988? Do we involve our management in support? Is this person having a crisis? It really is helping. And sometimes it just stops from there and staff feel like they feel connected and not isolated and that they are being supported. And right there is tenfold being priceless and being able to invest in that. So we really do need to reframe the care model in healthcare and the idea that staff do come first before the patient. I think we all can agree that without staff, there's no one to care for our patients. And so I'm going to quote myself from a previous talk I did years ago. And for those who are non-healthcare listeners, understand why our work can be so damaging. I stated in the past that for those that serve in the work we do, we can actually never unsee the things we see. But we can see ourselves set up for resilience by training our minds to process the critical events that change us and to grow as human beings. We all deserve tomorrow. And that might be looking like post-traumatic growth. And it's actually a reality. So the mind does heal just like many other organs do. And we really need to help and process that trauma. So I wanted to close out this podcast with a huge appreciation for those that tuned in. Please like and share. If you'd like to hear more of my podcasting content, I would love the support. I also want to thank and acknowledge the Nevada Peer Support Network community for all their tireless dedication they do to serve our servants. All our volunteers, I do serve as vice president for that organization. It's a 501c3. In order to stay sustainable, because of our donors, we need to continue growing our donors and receiving support. And our mission there is within unity, we find strength. And we actually support all service branches from nurses, EMS, first responders, law enforcement, veterans, the list goes on. And we could not do it without our village. It's sad that there's a need in society that we have this, but it's great to see that we have passionate entities taking care of each other. And it really is peer support at its grandest form. So if you are looking for resources that I mentioned earlier, you can check out our website at www.nbpsn.org. And last but not least, I want to also thank Nurse.org for providing me with this amazing Nurse Converse platform to allow for our voices to be heard. And just remember, all of you out there, because of each other, I am and you are, and because of Umbuntu. Take care and make sure you do your buddy checks.